There was a question about Derrick Rose's back pain. What is it that he has, and maybe what is it that's not allowing it to get better? Well, we know he's better because he played last night, and they did awesome. I was there, and he was awesome. But I know that Derrick Rose has had an ongoing problem with his big toe. They call it turf toe. And turf toe is an inflammatory process right around the joint where the joint is irritated and inflamed, and it hurts when you bend it. So for 2 years he had this turf toe where he wasn't able to bend his toe. Now, there are fundamental truths to back pain, and one of them is biomechanics, okay, the kinetic chain. And when we address patients in our clinic, we look for, first of all, what's going on within the back. Is it the disc bulging? Is the disc herniated? We typically give an MRI. But also, we look for what are the stabilizing muscles doing? What are the muscles doing that are next to the spine? What are the muscles doing that are in the hip? What are the muscles doing in the upper back? All the muscles that are variables for stability within the spine, both the front and the back, because your stomach muscles are stabilizers for your spine as well. So we look at these muscles, and then we look at the joints to say what joints might be causing a dysfunction in the muscle. And one of the joints we look at is the foot, because the foot is very, very, very important for stability of the back. It's called chain reaction, where you get a change in the foot, ultimately will change the way things are working in the back. Okay? So with Derrick Rose, and I was quoted as saying that he probably needs to fix his toe to fix his back, because they are one and the same, really. When you have a toe problem, like turf toe, what happens is you don't have the ability to toe off. Okay, he was wearing a plate in his shoe, and I know recently he just got an endorsement from Adidas for $250 million. And if they want to call me and ask for my opinion about his toe, I can tell them all about it and how maybe they can help with the shoe. But when you don't have the ability to toe off, it changes your gait pattern. And part of what happens during the gait process is as you get in the landing phase where your foot, actually this is the foot, as the foot is hitting the ground, the arch tends to go down a little bit, and it causes the ankle to shift, and it causes the knee to rotate in. And as the knee rotates in, the hip also rotates in. Now, the process of the hip rotating in activates the glute muscle. Well, the glute muscle is the very large muscle in the back. It's the most important muscle for running and for jumping. So if you have a problem in your foot and you're not able to activate your glute, you're going to get muscle fatigue at an earlier stage than normal because the muscles aren't doing what they should be doing. So the stabilizing muscles for the low back will start to get fatigued, and will start to develop a back problem because he's getting uneven stresses on the joint. So if you have a back or a two vertebrae and a disc, and you have a muscle that's tighter on one side than the other, ultimately what happens is you start to get a little bulging of the disc. Okay? Now, I don't know if he had a bulging of the disc because I never saw the MRI, and they said things were mostly normal, but he got back treatment, and then he got better after that. So we know that when the muscles are out of balance, you'll get this sort of irritation to one side of the disc that will cause back pain. So one of the things that we do is we have a process where we take pressure off the disc, where we sort of take the pressure off slowly over time. It's called functional disc rehydration. I know they had a process very similar to that. But also I know with Derrick Rose, if you don't fix the foot, it doesn't matter what you do to the spine, the problem's forever going to come back because of the muscle imbalance. So when I was on the radio and we talked about this, that was my point, that if you address the issue with the foot that's causing this chain reaction into the back, then the problem in the back will go away. And it sounds like he's on that path now, because he came on the radio later that day and said that he's addressing the issue in his foot because he knows the issue in his foot is causing his back problem. So we do know that is happening. We knew he's playing better. But also there's a point where if it's not quite 100%, then he won't be quite 100%. So the good news is, as well as he played last night, if his foot's still not 100%, which it doesn't look like it is, as it gets better, he's only going to get better as an athlete. So that's the good news.